matter what you're going through
or what you have been through,
thank God
it's fabulous. I'm Welda Paley.
And I'm Fassia Hilton.
Welcome.
Thank God it's fabulous.
Male nurses.
Patient comfort, values, and beliefs.
Thank God it's fabulous. What is cancer? What is your perception of cancer?
Well, today our guest will be sharing her story on living with cancer.
Thank God it's fabulous.
Friendship. What is a true friend? He's my friend. She's my friend. Can a male and a female be true friends?
What are the benefits of friendship? Are there true friends with benefits or not? How do you know somebody is a friend? What are the criteria? What are the requirements to have a friend?
Thank
God it's fabulous.
Well, today we are going to be talking about career choices.
Do you make career choices based on your habits, or things you love, or what is trending, or what would be your livelihood?
Is it going to be vocational or is it going to be higher education? What's your choice?
Ooh, good evening, good evening, good evening.
Yes.
It doesn't matter what you're going through.
Or what you have been through.
Thank God it's fabulous.
Yes, and it is a fabulous, fabulous Friday.
Yes, it is.
So many things happening.
I know. Today we bring you another presentation of skin problems.
Yes.
And this one is a whole family, all right, of Teneas. Tinea capitis, Tinea corporis, Tinea curis. Oh, we got a Teneas today. We're going to talk about all of them and what is it that you will benefit from. And we'll show you pictures today so you know how to take care of yourself in case you come across one of these fungus.
Yes.
Now, this is fungus. It's not contagious. Okay? So, Fasia, if you want to get started while I get the pictures together.
Okay, so like she said, we are going to be discussing the Tinea family, or the fungus family, or fungal infection. So what is tinea? Tinea is a fungal infection of the skin. Okay, this is also known as ringworm. I think that's the most common term that we all go by. And there are several families of the ringworm family, the Tinea family. We have 1, 2, 3, 4, 5. We have five different types, okay, or 5 different body types, I should say. So the first one we are going to talk about is the one that is the most common, and this is the medical term is Tinea pedis, or athlete's foot. In other words, you have fungus of the feet. Okay, and so this happens most times. It happens between your toes. All right, in between your toes, because usually that's where moisture is. That's where moisture is the most. All right, in between your toes. That's where people sweat the most. Or if you took a shower and you dry yourself, most times we don't take the time to wipe in between or dry in between our toes. And then that moisture sits there, and that is a breeding ground for fungus. They love moisture. Oh, that's a happy party place for any type of fungus. Okay, so this may be caused by sweating. Like I said, not drying between your feet after swimming or after bathing, wearing tight socks or shoes, or sometimes in warm weather. Okay, or sometimes, like for athletes, if they play sports, they play in that socks and they sweat a lot, and then they keep that wet socks on all day instead of coming home, changing it, and drying in between the toes. And so that's when you get that moisture build up between your toes. Now, let me deviate from that, but I'll still be talking about this athlete's foot. One of the worst athlete's foot I've ever seen is from a patient that bought secondhand shoes. I'm not going to say the name because I don't want to be held liable for legal reasons, but they bought shoes from a secondhand place that we all go to buy things, for cheap. And apparently, the owner of the shoes had athlete's foot, and that fungus just stayed there. And when this person bought the shoes, they didn't clean it, they didn't spray it, because there are fungal spray that you can spray in the shoes just to kill the fungus. And I mean, they had the worst fungal infection of the feet that was almost septic. I say this to say, be mindful when you buy secondhand shoes, or even if shoes has been given to you, be mindful. Make sure you clean it well, or make sure you can put it in the dryer, let it dry. The heat will kill the fungus. Okay? That's one of the First type of fungus is the athlete's foot. The second type of fungus we are going to talk about is Tinea puris. I'm sorry. Another term that we call it is jack itch. And most times this happens in men. Okay, and it happens in the groin area. Or for female, the peri area. And also again, this is a rash that comes on the groin area, or sometimes it comes on the inner thigh area as well. So let's just say if you're overweight and your thigh rubbing together and that moisture builds up, you are at risk of contracting what we call jack itch or Tinea puris. Okay, that's ringworm of the groin area, your private area. And this, like I said, this condition is common in men, is more common in men than it is in women. It's very rare in women. And it most happens in warm weather as well, or it's most common in athletes as well. Again, the same scenario. They play sports in the jersey, and the jersey is wet and sweaty. And instead of going home and changing the jersey, they keep staying in that wet jersey. And then, bacteria can grow. Fungus can grow. Okay? And then one of the ones that we are also common with is what we call the Tinea capitis. That's the wingworm of the scalp. And this is the one back home that we call hair kinky. I was driving today and I started to ask myself, why did we call this thing hair kinky? So I was at work today, and my boss, I was talking to him, and I said, why do we call this thing hair kinky? And he told me, he said, your hair is already kinky.
The kinky hair. Okay.
Yes, your hair is already kinky. Then the wingworm gets in the scalp or on the scalp. So that's why they say your kinky hair, that thing is in it. So hence the name hair kinky. Okay? But we can say hair kinky.
Look at your hair kinky hair there.
So that's the wingworm of the scalp. And this one is one of the hardest ones to treat, because especially in third world countries, we don't treat it correctly. So the first two, the athlete's foot and the jack itch, those are treated with topical antifungal cream. And most times you can get it from the dollar store. For $1, you will see the same thing in these other name brand pharmacies and paying more for it. It's the same topical cream. You can use that to treat the fungus on the skin. But with the wingworm of the scalp, you can treat it with that fungal cream until Jesus comes. It's not going to work. If it goes away, it went away on its own. It's not because of
You
that.
took me. Yep.
We have to give you an oral pill or an oral for the kids. We give them the oral liquid, the Gracioflovin. We have to give you that to treat the fungal or the wingworm of the scalp, because that is so hard to get rid of. And it spread like wildfire.
Yep. Everybody in the house will get it.
Because if someone has it and you use the same comb, or if most times the kid that comes to me with it, I'll ask them, when was the last time? If they don't know where they contracted it from, most times I will ask, when did you go to the barber? And for most cases, they will say, oh, I just took my child to get his or haircut. And that stems from the barber not cleaning his equipment. Because if you're shaving, the kid's hair or an adult's hair, you're reaching down the scalp. And that's when you see all the nitty gritty. And so if you don't clean your tools correctly, properly, then you are apt to spread that fungus from one client to another. Okay, and then most times with the ringworm of the scalp, when we do give them either the liquid or the pill, we tell them to eat it with fatty foods like ice cream or peanut butter because it helps it to, to metabolize and to work efficiently. All right, but one of the downside with giving systemic medicine, meaning you have to ingest it, is that those antifungal medications they they have a risk of affecting your liver. So if we are going to put it on a patient for a long period of time, normally we have to get a baseline of what the liver function is and then monitor their liver function because it's apt to increase your liver function level. So, but most times, if you're giving it to the person for 4 to 6 weeks, then and most times that's okay. But if it's for a long term, then you have to monitor their liver function. Please share the broadcast. And then the next type of fungal infection is the infection of the nail, the fingernail, or the toenail. And we call that Tinea ongonium or Tinea, what's it? I can't pronounce this. Onychomycosis. Okay, this is the infection of the toenails or the fingernails. That's when you see people with very thick, fingernails and it's yellow underneath, and you see the keratin or the fungal buildup underneath the nail. Or on the toenail, you see that really hard toenail that looks like a mountain. All right, and you see the yellow, or sometimes if it hasn't gotten that bad, you just see the discoloration of the toenail. And once we give you the toe and the fingernail also, we don't treat it with topical, meaning we don't treat it with cream. We have to treat it with systemic medication, meaning we have to give you something that you will ingest, you will have to swallow, you will have to take. So neither be the pill or the liquid. Most times it's the pill. And you will take it for about 4 to 6 weeks, depending on how bad it is. And then you will see the toenail will start to grow, and as you get the new growth, it will push out the fungus until that fungus has grown out. So it just depends on how severe it is. That's how long you will have to take that medication. And then if you're on it for a long period of time, then we have to monitor your liver function. And the last one is the ringworm of the trunk area. Or when we say trunk area, it's your body area, any part of your body besides your fingernails or your toenails. Okay, or on your groin area or on your scalp area. So it can be on your leg, it can be on your arm. Most times it will come on the kids, on the arm, or sometimes it will come on your face, or on the neck area. Now, if the ringworm is right at the tip of the hairline, back on the back of your neck, or right on the side here, then most times we can do the topical instead of doing the pills. But if it is inside, anywhere on the scalp inside here, then we have to do the pills. So the ringworm of the body is called Tinea corporis. And like I said, this is where it can be anywhere on the body or the face. And this is also, sometimes it can also be common under skin folds, especially
Okay,
if you're
so
overweight.
when you're ready for me, and then I'll bring the pictures to match up all those tinea cousins that you talk about.
Yes, I'm done with the different descriptions, so you can bring those pictures and then I will share.
Okay.
I'll share the broadcast.
Alrighty. So it's taking a minute. And the funny thing about the tinea in us back home, we thought it was because you don't like taking bath. You're dirty.
You're dirty, yes.
But it's from heat. So all that thing you're doing, washing it, doing stuff, by the time you go back in the heat, in the sweat, the moisture, it's not going away. You're still hustling.
Yeah.
But we'll normally say you're too dirty, you don't take bath, that's why you get it. But that's not so. And fungus are very hard to treat because they are yeast, you know. So taking care of them, consistency is highly required. So I'm going to bring to the stage now the Tineas. All right. So Tinea capitis was the first one Fasia talked about. This what it looks like. Ringworm on the scalp, and sometimes it come on the face. It like the soft tissue area. That's why it wants to go and sit down. It would never go in the place that you can't find it. Okay, so black people, that's how it look like on your head. Then the one we call head kingy, because it got all the little spot all around it, and that the one that will conk when you misbehave. That the hair can get spot that went conk. Can you imagine that? Growing up was tough.
It was tough.
All right, so we're going to Tinea corporis now. That's the one that come all over your skin. Some of it can go onto your scalp also, but mostly we know them to look like this. And in black people, they will look like this. Now, people can easily mistake them for seborrheic dermatitis. They think that's what it is, but we know from third world country, we know these things by their name. We can see and be like, that one where you get a dishcloth. And the person will be like, what? Dishcloth? Yeah. Okay. Ringworm on the body. All right. The next one is the Tinea pedis. So you see how some of them can look like this here. Don't always expect them to be only between the toes. They are fungus. They can go anywhere that moisture and heat is at. You wear a, like Fasia said, you go and you buy your shoes from the second hand. If somebody had that fungus and wore that shoes and you put your foot inside, there you go. You got it. No if, no and, no but. You get it. So you got to be very careful when you buy second-hand shoes, especially. Okay. Yeah, you go there again. There all of them looking funny like that. All right. The next one is Tinea cruris, or the Tinea cousin. We call the other name for it is jock itch. You see how it's in the groin area, and it itch like the bejeebus.
It does. Yes.
It ain't going nowhere. It'll be there watching you. Most time your patients will have creams that we rub to help with that itching, because that itching not for joke. It will itch you good. Okay. So versicolor, dishcloth, you can bathe. There go dishcloth, but it's a member of the Tinea family, and also it is not. None of them are contagious. They're just fungus.
Well, no. They are contagious.
Which ones?
Yes,
the pedis. Yeah,
they are contagious. Remember,
Yes.
I said if the athlete's foot, if you wear somebody's
yes,
shoes,
you was yes. It is.
Yes,
It is
contagious.
It is.
Or even if the
The
person
pedis.
has it on their body, and they scratch it, and there's liquid coming out of it, and you use the same towel, you are apt to contract it. So yes, it is contagious.
And the person, one thing, you cannot use a wet towel to dry your skin. You know how when you take bath and you have your towel hanging and it didn't dry too good, you can still take that towel and dry your skin. With this, you can't do that. Your towel have to be dry all the time you dry your skin. All right, let's go to the next one. It's the Tinea onychomycosis. All right, that one that hit your toes.
Yes.
See how they look there?
What is it? Ongonium.
Yes. You see how it make the toenail very thick? And I don't care what you do to this toenail. You can cut it. It coming right back looking like this.
If you don't treat it, Yeah, so when we give you, when we give you the medication, now the second one that says before and after, those two are easy to treat.
Yeah, the
It's not
flathead
as
one.
bad, and it hasn't gotten so thick.
Yeah, it's
So
just
we'll give you the
discolored.
pill, yes, and
Yeah.
then as the nail grow, it will grow out, and then your new nail will be fungal free.
Yeah.
But these two that are really thick and hard, I mean, sometimes there's nothing we can do about it. We can try to see if it will grow. Sometimes the podiatrist will have to cut that off and then see if, you can regrow new nail,
Yeah.
a new toenail. But
And you
once
know,
it
I
gets
tend
to this
to,
level, it's hard to treat.
in dialysis, we mostly check our patient feet, and most of them have thickened toenails.
Yes, and it's very common in diabetics.
Yes.
That's why, like you said, that's why we tell diabetics, you have to check between your toes. Because with diabetes, you lose your nerve endings gets destroyed. So you
Yep.
really don't get feelings no more in that area. So
So
they don't
true.
know, and they can have a big sore or a big wound, and they won't feel it,
Yep. Yep.
because those nerve endings has been destroyed. So
So please take care of you.
please.
This is your skin. You have to do the best you can do with it to make sure that these fungus don't have or avenue or home to live at. Because when they come in, they ain't leaving. They're not going to leave you. But you know what, Fasia? You know how back home we used yinikpa? Yinikpa is yinikpa. Yinikpa can really do some things to the skin.
You need a black soap?
Yeah.
It's very good, yeah.
Oh my goodness, that black
Very,
soap
very
is
good.
very good. It may not have the fragrance scent that you want, but that soap will clean your skin. Because on a daily basis, we have staff that live on our skin. They are inhabited that area. So we take bath regularly, we wash them off, but they ain't going nowhere. They colonize your skin and they live there. That's why for us in the medical field, whenever we have to do something to your skin, we got to chlorhexidine, help cleanse that skin, and use chlorhexidine thing just so that staff cannot penetrate the inside, because they live on the outside. They just want a place to go, and whenever you give them a chance, they entering, and when they enter, they cause more havoc because they get scared. They are in an environment they are not used to. So we say they pass gas. And when they pass gas inside, it's a problem for your body. They cause you serious gram-negative bacteria that can cause you to die if not treated, because they're going in the blood. So you got to be careful with them. When they're living on your skin and you don't get rid of them, one of these days you will nick your skin and they will have an entryway.
Oh, yeah.
So you got to be very careful and take care of your skin. Anything else, Vasia, you want to add?
Let's see. What are some of the symptoms that you would get from this? The most common is the itching,
Yes.
and sometimes you might get the burning from under your feet when you have the tinea ungonium or the onychomycosis. So that's the fungus of the toenail or the feet. And then you would also have scaling of the feet. And sometimes when it gets so bad, you will have blistering of the feet.
Yep. And they have this musty odor smell to them.
Yes, yes.
That's how you know them.
Very, very musty.
Yeah.
So who is at risk for contracting any type of tinea infection or fungal infection? If you live in warm climates,
Yep.
you are at risk. If you come in contact with people or pets that have tinea or fungus, you are at risk. If you play contact sports like basketball, volleyball, football, soccer,
Yep.
Any type of contact sports. Wrestling
Yes.
is the worst one
Yep.
because that's when you're intertwined with, your opponent.
Firstly,
So
can you imagine you and somebody doing serious wrestling fight and you look up and
and
you look at the
I
skin
will
and
lose
the
you.
guy, you will beat me
Take your
because
win.
no, you
Take
better
your
get off
win.
me.
Yes.
Yeah, yeah, that
Yes.
contact will make it run good. And the next thing you look on your arm and you got someone there living there now.
Yes.
Yep, so
Or if
true.
you if you
So
if
true.
you share bathroom or locker rooms, you have to be careful.
Yes.
So if you're
Ooh.
sharing the same slippers, the same shoes, you have to be careful. If you share
Yes.
towels or clothing or combs or brushes, you have to be careful. Again, like I said, when you go for the guys that go to the barber to cut their hair, make sure your barber is
Yes.
sanitizing.
Is disinfecting those
Yes,
shavers. Yeah.
because that
That is
puts
so
you
true.
that puts you at risk. Yes.
Yeah.
And
And
then
some people do get it from the barber shop.
yes, most
Yeah.
people.
Yeah.
Most people get
They
it,
come
especially
home
from
and
the
now.
scalp. They get it from the barber shop. And then, here they say have poor hygiene. I guess the poor hygiene would be, if you're not wiping between your toes,
Yep.
keeping moisture on between your fingers, your toes, you know.
And washing it, even and not drying it, is worse because
Yeah,
you just create the dampness that is looking for to survive.
exactly.
Yeah.
And then another risk factor is if you have a depressed immune system
Of course.
because of disease or medicine. And also, if you don't have good nutrition, that can put you at risk.
Yep. And of all of them, the tinea versicolor is the most common.
The athlete's foot is the most common. From what I read, the statistics is that one is the most common of all. But of the body, yes, the tinea vesicola.
Yeah.
So, and then
Because one thing you gotta know, the name goes with the location.
that's it.
So where it's at will have its own name for that place.
And then how is the infection diagnosed? Most times, once we see it just from assessment, from looking at it, you
Yeah.
can take an educated guess, just from experience and knowing how it is, how it presents. You
Yeah.
can you can diagnose it, but sometimes there's some that are pretty iffy. So sometimes we might do stripping of the scalp, and then we'll put the KOH solution on it and put it under the microscope. And what we look for is the hyphae. Okay, and then once we see that, we know that it's a fungus. All right, and sometimes too, if it's really, really bad, then sometimes you have to do a biopsy, but those are extreme cases. And sometimes they say do skin culture. Again, those are very extreme cases, but most times it's diagnosed from just your medical examiner looking at it, and because of experience knowing what it is, then they can diagnose it.
Professor, do you know that the tinea on the scalp, sometimes we mistake it for dandruff? And between dandruff, seborrheic dermatitis, you can highly tell the difference.
True, but with the tinea of the scalp, most times you will have loss of hair in that area. So that's where you tell the difference. Whereas the dandruff, the hair is still growing, underneath the dandruff. So it's that's one of the differences how you can tell. And then also, with the ringworm on the scalp, the bordering,
Yeah, the
yes,
irregular border.
you can tell from that.
Yep, yep. And when infants are born, they carry that cradle cap.
Right.
Some of them
Yes,
have
that's
it.
totally different.
Yes. So
And that's totally normal for most babies.
yes. So between that, the psoriasis, you know it from the scaly patches, then
Exactly.
eczema.
Yeah.
You know, see the different eczema here will flare up on the cold weathers. This
True.
tinea will flare up on the heat.
Heat. Yes. Yes. But the psoriasis, I mean, so because the psoriasis has the plaque as well, you know, the plaque that would develop that little white scaly silvery plaque on your skin. And with that, the way I explain it is dead skin growing instead of your skin shedding and new skin, you know, being presented. Your dead skin grows over the new skin grows over the dead skin. You see what I mean? Instead of it shedding, it doesn't shed. So then that's when you get, I mean, we're going into the pathophysiology here, but that's pretty much with the psoriasis.
So don't get it mixed up. There are different families here with the family members. Seborrheic people got their own group, and
Yes.
tinea got their own group.
Exactly.
Okay. But yeah,
Most
this
times it's the kids, you know, because
yes,
it's
young
it's
adults
prevalent
and
in
teenagers
kids.
will
Yeah.
deal a lot with
Young,
the
young
versicolon, the capitis, the and then the older young adults will deal with the curious.
Yes.
If you're not doing what you're supposed to do, you deal with that growing area. But this is very good. And but you know the funny one that I've never really heard them call it by name, you know, the one that come under the female breast or that damp area, that redness. I've never really heard anyone call it by name. They always say, oh, it's a fungus infection.
Yeah,
And they
it's
put
part of
nystatin on it.
yes, it's part of the tinea curis. We're part of the body. So
Because it smells like them.
yes.
Yeah.
So and most times it's for those that are those that are overweight or if they have big, you know, huge breasts,
Yeah.
then this ground for moisture to sit there, especially during hot weather.
Oh yeah.
So then it starts to get red and itchy.
Itchy.
And then like again, we treat those with the topical cream, and you can just go right to the dollar store and get the Atlas foot. It's the same thing. Instead of paying $10 for it at the other entities, you can just go right to Dollar Tree and get it for $1.25, and it will do the same thing.
And you know, tinea versicolor is also called pityriasis versicolor.
Yes, yes, it's just another name. Just another name for it. But that I think that one is the one that we have more common in
Common back home.
Nigeria.
Yes.
That's the one we call
And
it.
everybody know to get that graciofulvin
Yeah.
to take it.
Yeah.
Even
But
children
you know-
can treat
you know,
themselves.
I was just thinking just now.
Uh-uh.
So you see this dish here?
Uh-huh.
Where it has the little net
Uh-huh.
over it.
Uh-huh.
I think maybe because you know we used to use these dishcloths back home like this.
Uh-huh.
I think because of the net, you know, and somebody just said, "Oh, that thing looks like dishcloth."
Because you know, for us, everything has to be something.
Yes.
Yes.
It just,
Yes.
it just dawned on me just now. Maybe that's why we call it dishcloth because this particular type of dishcloth has the little net that you know put on top of the cloth. So, and that picture that you showed, you can see the mapping that looks like little nets.
Yeah. Yeah.
I'm thinking not that one, the tinea versicolor.
All
So
right.
you see the little, it looks like a little net on the bottom one.
This
You can
one.
see it, you can see it very well. The one next to the one with the hair.
This one. Oh. This one.
I'm not seeing your pointer.
Oh.
But it's you got the top one, not that one, the one on the bottom.
Yes.
But
The
one
next
with the
picture to
hair.
it,
Yes.
not with the
Yeah,
hair.
got that net, little net, fish net.
Yeah, looking like it won't be in the dishcloth family.
Yeah, so maybe that's how we need the dishcloth.
Maybe.
I don't know, but yeah.
Yes, yes. So true. So true. And you know, for us, it has to make sense. So we will call it something that we can identify it with.
Buy it with, yeah.
Yeah. Yeah. Yeah. But yes, today is your day of fungus. If you got questions, call in. Let's talk about it.
Yes. And then
And
also with the scalp, not only do we treat with the pills or the liquid, but we also give you shampoo.
yes,
We also give you the
yes,
antifungal shampoo. And sometimes if they have the tinea vesicola, I will also order them to bathe with the shampoo maybe 3 times a week or 4 times a week as well. Because the shampoo is very concentrated.
okay.
So you can use it as a shower gel as well. Instead of doing bath soap for those 3 to 4 times a week, you can use the topical cream, and you can also use the shampoo as a shower gel.
And you know the funny thing, it come in such the Terrasil especially come in such small packets, and when you think about your body size, you're like, Jesus Christ, how many of
Yeah.
these? And they got a soap to go with it. They're just trying to eat your money. Yeah, man. Yeah. Yeah, but today we hope we were able to share some light on this fungus and where you live at and what you could see a lot of, that at least you got an idea now what you can do about it. But your black soap don't tell you no lie. Take that bath with some
Right.
sapo.
That's it.
Yep. Black soap and sapo never lie.
So that black soap is good. So there are just a few key points about tinea infection.
Okay.
The first one says tinea is a fungal infection of the skin. It is also known as ringworm, but it is not caused by worms.
Yes.
So please know that when your child, when we say ringworm, it doesn't mean that they have worm or they were playing in the dirt and they picked up some worms, so that worm caused the infection, the fungal infection. No.
And you know daycare children like to come home with ringworm.
Oh yeah, because you know they're in close proximity with each other. You know, and it will spread like wildfire. And
Yep.
then another tip is the fungus is very contagious and can be spread from person to person. So please
Yep.
know that this fungal infection, any type of fungal infection, is very, very contagious. Okay? Also, tinea infection can affect any part of the body, but it
Yep.
is most often occurs on the feet, the groin, the nails, the body, and the scalps. And another tip is treatment depends on what part of the body is infected.
Yes.
It may include
Yes.
antifungal cream, shampoo, or medicine by mouth, which we've discussed already.
Yep. Yep.
And then the last key point is that some type of tinea infection can be prevented if you don't share personal hygiene products, clothing,
Yes.
or
So
shoes,
true.
and keep your skin dry.
Now, please don't get it mixed up. Dry don't mean don't put lotion on the
Lotion on
skin.
your skin.
Because that's a different kind of dry. You're looking for
Right.
trouble dry. Okay? We mean water, wet, moisture. No.
Exactly.
Okay. Yeah. Well, Fasia, I think we did a good job helping them out with the tinea cousins today.
That's always.
So, yep. At least now you know. Remember, knowledge is always power.
Yes.
You have this knowledge, use it to help somebody. If the information is not for you, you might know somebody who need it. And share the broadcast. Somebody will see it, somebody will learn, somebody will get help. All right?
So true.
Yep. Well,
Well, we hope this helped. And like we said, we've always said, if you have any information or disease process that you want us to discuss, please feel free to send us a message.
yeah.
And we don't know it all, but we all can learn together.
So
Knowledge
true.
is power.
So true. And please, the holiday is coming. A lot of people are going to start stressing. Listen, it's not must. It's not force. Just be happy. we pass this era and stage anymore. My Christmas on you, my New Year on you. Somebody gets stressed out when they can't come through for you on what it is. You know, give what you can, accept what you receive. Don't impose on anybody. These times are very stressful for everybody. Back home, we say January month coming. That when everything gets hard because we spend everything for the holiday, and there we are with nothing. So be wise. Let next year and the end of the year be different in your life. Don't stress yourself. We keep repeating there until the holiday is over because we know a lot of people will get stressed out just because of how they planning and want the holiday to go.
So true.
Well, it doesn't matter what you're going through.
Or what you've been through.
Thank God is fabulous. Have a good evening. Sometimes we run over your time, but today we're going to let you leave early.
Yes.
All right? You got 12 minutes to use wisely. Please continue to share the broadcast, continue to educate and help somebody. Knowledge is power. Good evening.
Good night.